Hi guys, Dr. G here with Checkups with Dr. G, and we are back. These videos will be posted in my Facebook group, Hold You with Dr. G. I'll post clips of the videos to Instagram and my Facebook page, and eventually they will go on YouTube. But for first look, they're going to be posted to the Facebook group first. Also, any lives that I do, or if I have exclusive content, it will be posted in the Facebook group. So if you're a part of the group, thank you for your support and congratulations for being my first look group. If you're not a part of the group, please make sure that you go ahead and join the group now so that you can get first look at my videos as well as any exclusive content that I share. So today, guys, I'm going to be talking about broken heart syndrome. I've been seeing videos, posts go around about that. And so I just wanted to give you a little bit of content as it relates to broken heart syndrome. So broken heart syndrome is going to be a disorder or disease that shows up very similar to a heart attack. So anything that you're experiencing, such as shortness of breath, chest pain, near fainting or fainting, any of those things that would signal you to believe that you might be having a heart attack can also be symptoms of broken heart syndrome. However, broken heart syndrome does not occur as often as a heart attack. So if you are experiencing those symptoms, please make sure that you go ahead and call 911 because you don't want to risk or chance having a heart attack thinking that you have broken heart syndrome. It's not as common, guys. So please make sure that you go ahead and call 911 and get evaluated. Even at the hospital, the workup that they're going to do on you is very similar to someone that they believe is having a heart attack. The difference between the two is that with broken heart syndrome, usually there's no blockages in the blood vessels of the heart where there are blockages with a heart attack. But they are not going to find that out until they do the workup. So please make sure that if you're experiencing these symptoms that you go ahead and go to the hospital. Call 911, go to the hospital immediately. Broken heart syndrome, usually there's a quicker recovery than if you had a heart attack, and also is usually a complete recovery. Some people may have damage to the heart muscles. Some people may end up with low blood pressure. And some people may also have heart failure as a result of broken heart syndrome, but usually there's a complete recovery. Now, broken heart syndrome is also called stress cardiomyopathy, so it can be caused or is usually caused by emotional or physical stressors. We talked about eustress and distress in another video that I had, and broken heart syndrome can be caused by either. So a surprise party or winning the lotto can cause broken heart syndrome. A great financial loss can cause broken heart syndrome. The loss of a loved one, experience a intense fright or get a frightening diagnosis, asthma, any of those things can cause broken heart syndrome. The exact mechanism is not really known as to what it is that's causing broken heart syndrome, but certain medications that may cause fluctuations in your hormones may also be a trigger, such as epinephrine, which can be EpiPen, or levothyroxine, or which is also known as Synthroid for thyroid hormones. That can also be a trigger. But again, if you're experiencing these symptoms, you don't want to assume that it's not a heart attack, because you absolutely need to go get the workup to be sure that it's not a heart attack. Broken heart syndrome, guys, like I said, it can be caused by stressors. You want to make sure that you're paying attention to your symptoms. It's usually a quicker recovery, usually complete recovery, but you want to take it seriously. Either way, take it seriously. There's not really a lot that you can do to prevent it. Stress management is always in order. I have a video about stress and stress reducing. So you want to make sure that you are putting in place your stress management practices, and that may help with reducing the likelihood of having broken heart syndrome. And it also helps out just reducing some of the stress on your body in general, because as we talked about before, chronic stress can cause things such as hypertension, and cause stresses on the body that can put you in a position to be more susceptible to things such as stroke and heart attack. So stress management is always in order. Usually there's not another occurrence of broken heart syndrome. If you have it once, it's usually just that one time. Not saying that it can't happen again, but usually it's just that one time. But again, guys, if you're experiencing symptoms of a heart attack, please call 911. Absolutely make sure you go to the hospital and get evaluated. But again, this is Dr. G here. If you guys have any questions, any concerns, if you have a topic you want me to cover, please feel free to message me on this video. Comment on this video, message me on Facebook, Twitter, or Instagram at Whole You with G. You can also instant message me or message me on my YouTube page, and you can also send me an email at wholeyouwithg@gmail.com or drg@wholeyouwithg.com. Again, this is Dr. G, and I will see you guys in 2 weeks on the first Wednesday in March. And I hope you guys have an amazing rest of your day.